Hello, and welcome to Wellness Education. I am Dr. Jess, and you will not be seeing me on video here because that would just take way too many takes if I could see myself on video. But I do want to introduce myself. I have been with Blue Hills Chiropractic for 8 years, been a chiropractor for 9. So I just know what questions patients tend to ask over and over, and I am here to answer a few of those a little bit more in depth that I can maybe table side. So just giving you those deep dive answers that I'm really excited to be able to kind of get into with you. I'm a Milwaukee native, so I have city roots, but I like to say I have the lake life heart. I'm absolutely in love with the Northwoods, but I've seen what resources there are here and what more access looks like. So I'm excited to dive into some of the things that Blue Hills Chiropractic offers here that are kind of new to the area. And I'm just excited to kind of explain some of those as well. And then also to say, I am CACP and Webster certified. You don't need to know what those stand for, but it just means that I've done more training than your average chiropractor on neurological chiropractic. And that's what I am here to talk to you today about. So the two questions that I'm most excited to answer are how do I hold my adjustments longer? And what could cause my neck, back, shoulder, whatever it is, to suddenly go out of alignment? Like some people like to say, like, why did this happen? Like, what happened here? And I'm here to kind of explain that and explain what we can do um, to get a little better, to make it happen less often or less likely to happen. So we're going to dive into those. And the only way to start doing that is for you guys to really understand what does an adjustment do. And I'm going to get a little bit of nerdy here, so hang in there with me, but this is going to give you a basis on kind of what's going to be going on um, for the rest of the presentation. So chiropractic adjustments, they correct spinal misalignments when your spine's out to improve nerve function. So Dr. Heidi Havoc is the big chiropractic researcher, and her research shows that adjustments don't just move bones, they change your brain processing, especially in your prefrontal cortex. That's a part of your brain. So when a chiropractor adjusts your spine, it creates a sensory input that resets the communication between your spine and your brain. So this is what like fancy scientists call sensory motor integration, but what that really means is basically how your brain interprets and responds to your body signals. Like in chiropractic resets that and makes that better. So by restoring that proper spinal alignment, adjustments optimize your nervous system's function, and that gets clearer communication between your brain and your body. What that all comes down to is that the result is better overall health as your body controls systems that work more efficiently and communication pathways are unobstructed. So basically, chiropractic helps get your brain and your body talking to each other better. And that is why we do those like neurological scans. So since we just talked about like your nervous system controls every function of your body. Your brain tells your body what to do with your nervous system. So the scans we do tell us how well your nerves are communicating with your body. So every like physical, chemical, and emotional stress impacts your nervous system. So when nerve communication is disrupted or it's not quite talking as well as it can, your body can't function at that 100%, can't get that 100% communication. This leads to pain and dysfunction and decreased healing capacity. And our scanning technology allows us to identify these disruptions in nerve communication so we can develop a targeted treatment plan to restore optimal function and help your body heal naturally. So that's why we recommend more adjustments as your stress levels increase because it needs to match your scans or how your nervous system's doing. So that's why we heavily rely on these neurological scans, and they're so important because they literally tell us how well your brain and your body are talking to each other. So the question being, how like what can I do? What can I do to hold adjustments longer? What can I do to like feel better between adjustments? Um, there are going to be six things we're going to be talking about. We're going to jump into advanced spinal therapies, nutrition and supplements, at-home exercises and stretches, hydration, sleep, and reducing stress. So we're going to jump into all of these. I promise this isn't going to be super long. So if one of these doesn't interest you, just hang in there. We will get to them all. So starting with some of our advanced spinal rehabilitation, um, if you are happy with your results, that is excellent. But there are probably some other things you can do to improve your health, and these like advanced treatments aren't necessarily for you. But if you're having pain, stiffness, radiating pain, tightness, these are great options for you. If you're like, man, I still want to feel better, even more so than just with my adjustment. So that's kind of where we're going to start today. So our first is decompression. So decompression is going to be for people who are more stiff than they want to be regularly. It is, you can also do more like acute pain, like if you do have a little bit more of a trauma that goes on. But this is, and that's good, but this is also really for people who are like, man, I sit at a computer day all day, my neck is still really stiff. Or if I sit too long, my low back bothers me. Or if I do too much, this kind of starts to bother me. And that's really what decompression is great for. And it just gently stretches your spine to relieve some of that pressure on discs and nerves, and it gives nutrients and hydration to those discs and some of those soft tissues around. I like to say this is for a lot of like spinal things, like spine and some of that like neck, shoulder, low back, your pelvis. That's what decompression is going to be really good at. It can also go for more of that like radiating pain, like if it comes down your arm or down your leg. Decompression is really great for that. Our next therapy is shockwave. Think more extremities when we're thinking about shockwave. This is going to like help stimulate some of those damaged tissues. So this again is going to be something for like if you're in pain, this is to help get you out of pain. It can help break down some scar tissue. It can help promote blood flow to help those injured areas heal a little bit more. So this is going to be more for like your true shoulder, any rotator cuff injury or like knee pain, like listed on here, wrist pain, elbow, foot, any of those. It can be really, really good to help stimulate some of that healing in those areas. Now, if you're like, man, I don't know if I'd be more of a candidate for decompression or shockwave, don't you worry. That's what the doctors here are here to tell you. We've taken extra training. We are certified, so we can tell you exactly what you need, um, and what's going to be, the best for you to get you feeling better. So if you do have any questions between those two, that makes a lot of sense. Just let us know. So then another therapy we have is our hydro massage. This I like to think of as for relaxation or like global body stiffness. If you're like, man, I can't really pinpoint it, it's kind of all over. Hydro massage is an awesome therapy for you. It helps increase some of that circulation, muscle tension and spasms go down. And again, it's really relaxing. And you can get those like sore muscles feeling a little bit better. And then the last one I'm going to talk about today is stim. Stim has really helped to reduce pain. I like to use it in more of an acute situation where if like something flared up or is bothering you, stim can be a really good way to manage that and decrease your pain faster than just an adjustment. So that can be a really great option for people looking to get better faster. So we've already moved through our advanced, spinal rehabilitation therapies. Now we are looking more at nutrition because if you don't have the right nutrition, your body isn't going to heal like we want it to or perform how we want it to. So we break our like foods up into three different categories, and that is a carb, a protein, and a fat. So we use our carbohydrates for more of that quick energy and recovery. Carbs are actually your body's primary source of energy for fueling your muscle and your brain. And I know they get a really bad rep, but they really are important. So we want to focus on more of those complex carbohydrates like fruits and vegetables and whole grains provide more like sustained energy. And they also help, with tissue repair after adjustments and all of those good things. They can really go the wrong direction though if you're not careful about what kind of carbs. So like the refined sugars, the processed carbs, those are what's going to spike that inflammation and slow your healing down. So making sure we're getting those good carbohydrates are important. Protein. Protein is probably our clinic's favorite. If you're going to focus on anything, we recommend focusing on your protein. That's going to help with muscle repair and strength. Proteins are kind of that building block of muscles, of tendons. Um, Connective tissues. So all of those high quality protein sources are essential, are giving you that essential amino acids that aid in muscle recovery. Um, they reduce some post adjustment soreness if you do have any of that, and they help stabilize spinal structure for like longer lasting adjustments. So they are um, super important. They also help keep you full. Uh, like they help you to not like, unlike carbohydrates, which is kind of that quick energy. Protein you break down a little bit slower, um, giving you a little bit more energy for that. And then for fats, fats are going to be for like your nervous system and your joint health. Those healthy fats are essential for your nerve function, uh, cell membrane integrity, some reducing of some of that inflammation. So the big one that you want to look at are those omega-3 fatty acids. Those are going to be found in like your fish and your flax seeds and your walnuts. They help decrease joint stiffness, improve synovial fluid production, which is your brain fluid, and uh, help support some of that nervous system regulation, making chiropractic care more effective if you're getting all of those good like hormones moving around, and doing exactly what they're supposed to do. So all three carbs, proteins, and fats are important. To make sure you're getting the right amounts and the right kinds. Talk to your doc if you are like, man, I don't know if I'm getting enough protein. Talk to us. We'd be happy to kind of break that down. Newsflash, you're probably not, because protein is tough to get in if you're not focusing on it, but we'd be happy to talk to you more about that. So then we're looking more at that, some at-home exercises. So we get asked a lot about some at-home exercises, and if you do them at home, your adjustments will absolutely like feel like they're lasting longer. You are going to feel better when you're doing them. It improves that flexibility, mobility, so they like prevent stiffness. Making adjustments a little bit easier for us and more effective. It boosts that circulation, which helps deliver oxygen and nutrients, so those tissues recover faster. It reduces some of that pain and tension. Um, it prevents those recurring misalignments. It prevents you from coming out over and over again. And then it supports that nervous system function, kind of like we talked about, enhancing chiropractic care overall would be great. And then preventing future injuries. Obviously, if you're less likely to pull something out, you're less likely to become misaligned. But talk to your doctor about specific things that are right for you. Um, because what we don't want to do is, I don't want you to go home and do a bunch of stretches and you're like, none of them work, so now I'm not going to do any of them. We have options to make sure that you get the right ones. We do have some like aids and some tools that can maybe help you. It's not just stretching your neck. Maybe you need a cervical block as well to help restore that curve. And we would be happy, we would be thrilled to talk to you about exactly what you may need and what's going to move the needle most for you at home. So then we're talking about supplements. So supplements, it kind of goes along with nutrition, but if you're not getting everything you need from food, which we all try to be, but it's really tough. We can then look at supplementing some of these things. And just like I talked about before, all of these need to be more specific to you. These are just four that I'm going to go over super fast, just because they are probably the most common we recommend. So magnesium, I think it's something like the last study said 85% of Americans are deficient in magnesium. So that's something that you very well may benefit from adding in, and it helps with that muscle recovery, nerve function, digestion, sleep. Like it's great, that magnesium. Sinuplex, I really love recommending for anybody who wants some support for their mucous membranes, wants those clean airways. We also have a kiddo version that we can barely keep on our shelves because it's it's super helpful. So that's another one. Element, we're going to talk about hydration, but it's basically an electrolyte drink mix with no sugars. because you don't want to be adding all of those carbs we talked about earlier if we don't need to, because it's not those complex carbs that they add in those electrolyte drink mixes. But element's really great because it gives you what you need to help you stay hydrated without the sugars. And then vitamin D, um, especially in Wisconsin, it's a common deficiency. It helps with some of that immune system, so you want to make sure you're getting everything you need, especially in winter. And then who doesn't have brain fog every once in a while? Vitamin D can help with that too. All right, so I kind of alluded to it, but hydration is important. If we do not have the hydration we need, it's really hard to get your adjustments to stay and like to be in a really good spot because like your body doesn't have what it needs, and your spinal discs are mostly water. So staying hydrated helps prevent some of that shrinkage and stiffness and discomfort. It also flushes out those toxins. So adjustments can release some of those toxins from your muscles, and water is really what helps get rid of them, decreasing some of that soreness and that fatigue. So your body's not like fighting off all these toxins. It enhances nervous system function by that nerve signal transmission and improving overall function and healing. It can reduce that muscle tension and improve flexibility because dehydration causes tight muscles, and water keeps them nice and supple, making adjustments again easier and more effective. And then it just supports that faster recovery. If Since water aids in that tissue repair and reduces inflammation, as you can imagine, you're going to heal quicker with more hydration or with the appropriate amount of hydration. And then your hydration goal. Basically, just take half your body weight in ounces of water, and that's how much I would love you to be drinking each day. Then we get into sleep. Sleep is super, super important. And I know it can be a time thing. And also, a lot of people come to us because they're not sleeping so well, and chiropractic can help with sleep. So they kind of do go hand in hand, going together. Like the more chiropractic care you get, the more likely you are to sleep better. And, the more you sleep better, the better chiropractic can help you. And you can notice a difference in all of these adjustments. So they do go hand in hand. But again, very, very important. You can kind of see that it aids in that tissue repair. Um, if you have poor sleep and it's going to increase that inflammation, it's going to make it harder to heal and respond well to chiropractic care. So that's why sleep's super important there. We've kind of talked about how important it is, to rest that nervous system. Sleep is when it actually gets that rest, that downtime to be able to heal. Sleep helps your muscles relax and it reduces that tightness. And if your muscles are super tight, you're not as fun to adjust. Well, you're still fun to adjust. You're just maybe not as easy to adjust. Um, and then, as you can imagine, if your body is getting poor sleep, it actually lowers your pain tolerance. So you do not have the tolerance, and everything seems worse. And that's kind of overall in your nervous system, but pain is an easy one to point to when that happens. So have a goal of sleeping to 7 to 9 hours a night, as often as you can. And then the final thing we're going to talk about is reducing stress. So, kind of like sleep, chiropractic does help you deal with your stress a little bit more. But if you are able to reduce some of that stress, then your chiropractic adjustments are going to hold longer. So, chronic stress like keeps that nervous system in that fight or flight mode, and it reduces the like you need more care. Your care needs to match. The amount of stress you have. So if you're able to relax or able to cut some stress, that's going to help those adjustments hold longer. If you are in a lot of stress, if you are in a more stressful situation, you should really get more chiropractic care because that's going to help your body adapt to it, and your adjustments just aren't going to hold as long. As you can imagine, when you are stressed, your muscles get tight. That we talked about this over and over. Um, that there's a lot of things that can create that tension, and chiropractic is going to help with that. But the more tension you have, the more chiropractic care you're going to need. And then we've talked about how that can uh, how that high stress increases inflammation, and that's going to slow your healing and worsen your pain. And then just like chiropractic and all of this, um, the less stress you have, the better sleep you get. You actually stay more hydrated. So all of these things go together. So if there is a place that you're like, man, this one area I'm really not doing quite so well in, if you increase that, the rest is also going to improve as well. So if you improve one thing, a lot of things in your life are going to improve. And these are just good ways and good things to focus on that can make a big impact in your life. So if you uh, have any questions, please ask us because this is kind of our jam. This is what we want to deep dive more. Now that you have a baseline and maybe you know what questions to ask, um, this is what we want to talk to you about and kind of get you some specific things that you can work on um, individually. So when you come in next, or if you need to shoot us a text, you guys know how to. Um, just ask, and we'd be happy to deep dive more into this with you. But thank you for taking some time investing in your health. And we can't wait to see you next.